Okay, we're on. I did the like, oh, I have time for 3 more tuck-ins and 5 more kisses, and then I'm running downstairs and scrambling. But we're here, and Dr. Gallus will be here any second. And tonight we're talking about male plastic surgery, which is fun because, people always think of plastic surgeons as women. Okay, I see Dr. Gallus. Let me pull her on. We got the Instagram working now. Dr. Smith is here. Hey!
Hey!
I'm like scrambling. It's my usual. I have time for one more goodnight kiss and one more snuggle, and then I'm like, oh crap, it's 8:30.
Yeah, I managed to get home a little bit earlier today, so
nice.
Not like literally running up the stairs.
No, it's just like
slam the door. Hi, bye. Yeah.
I know. I'm like the queen of I can fit in one more thing, which I can't. But that's
Yeah.
okay. How are you? It's good to see you.
I'm good. How's it going?
Good. I'm excited to talk about male plastic surgery tonight.
Yeah. I mean, it's half the population. They deserve to look and feel better too, right?
Yes. Although it's, I will say, proportionally a much smaller percentage of my practice is males.
Absolutely.
Yeah. Mm-hmm. Yep. But they're, a lot of them are like totally average people who just want a little Botox, or they don't want to look angry, or they don't like the forehead lines.
So besides Botox and maybe an occasional filler, what would you say your most popular surgical procedure is for men?
It's definitely body contouring category. I would say lipo as a whole, if you especially include the chest and gynecomastia.
Okay. Yeah, I would agree with that. So I think I would say liposuction is probably the most popular.
Yeah, it's like those love handles. That's the area right there.
Yeah. It's very stubborn. So even if you're at a healthy weight, it's your, where the beer and tacos hang out. And at least in San Diego, that's what it is. Maybe your IPA and tacos are hanging out.
Yep. Yeah, we have beer and donuts. I don't know. Cleveland's all the Midwestern junk food. But yeah, like you said, even if you're at a healthy weight, a lot of guys have that hip fat that just doesn't want to go away.
Yeah, 100%. So yeah, it's easily accessible with lipo. We've talked about liposuction before. I feel like for a while, men were trying to do the cool sculpt thing because I do think they perceive having a surgical procedure as a much bigger step to take. And so the idea of like, maybe you could just inject something magical and it'll dissolve the fat, and I can say I didn't have surgery, is appealing. But really, liposuction is the way to address love handles.
It is nice.
Right?
Although I have gotten some really good results on guys. I have a couple who are like active military. And so they don't want any downtime, can't handle any downtime. And we've gotten really nice results with them. But then I've had a couple who are like, yeah, let's just do the lipo.
Right. And yeah, I find sometimes if I have it at my disposal, I'll use Vaser to start with. Just because it makes the rest of the liposuction a little bit easier. So for those that don't know, Vaser is just an ultrasonic liposuction cannula, and it uses ultrasonic energy to sort of melt the fat a little bit.
Yeah, it's kind of magical. I've actually never used it. It's just not something I've had access to, but it is pretty magical.
Yeah, I remember being very skeptical at first, though, because we had an ultrasonic liposuction machine when I first joined the Navy, and it didn't work that well because it was ancient. And like most things, it went away, and then it got back as Vaser, and you're like, are you going to try and start with ultrasound again? But they've done so many improvements to it. It is really excellent.
More powerful.
It does melt that fat. Less concerns about overheating the tissue, because that's the side effect is heat. And the love handle area on both men and women is kind of fibrous. And so it makes that a little bit easier.
Yep. Well, and that's an area I I love using a basket cannula, which, so
Mm-hmm.
cannulas were carpools and cannulas, but the cannula is the little metal tube that sucks out the fat. And it usually just has little holes around it. But a basket cannula has like a little wire frame around it. And it's a really nice way to break up the fat mechanically if you don't have access to a vaser. So a lot
Mm-hmm.
of plastic surgeons, and I bet you probably use that when you don't have vaser. Mm-hmm.
Yeah,
Yeah,
I love that basket cannula. Yeah, I have
me
one I
too.
take with me in case if I'm at a new place and they're like, "Oh, we have liposuction, we have cannulas," and they're
You're
like, "Do
like,
you have
need my
this
basket.
one? Because I need this one."
Yeah,
Yeah.
it's super helpful just to break up the fat. And then at the end, you can kind of redistribute what's left and get this really nice smooth result. It's actually a technique called safe lipo, which stands
Mm-hmm.
for separation, aspiration, and fat equalization.
Yep.
But yeah, those fibrous hips, which I've had my hips liposuctioned, and it was awesome because it was just, again, like even when I was at a fairly healthy weight, I just had the muffin top. But
Yeah.
I do think guys tend to carry that a little bit more. And then the chest fat too can be really fibrous. And with gynecomastia, for those of you who don't know the technical medical definition, gynecomastia is the glandular tissue that really commonly occurs in guys right behind the nipple. So you'll feel like this firm little lump of tissue. But it
Yeah.
also, they also get a little extra subcutaneous fat over the chest. So we do liposuction to remove the subcutaneous fat. Sometimes that little bit of glandular tissue is so small that once you get rid of the fat, it's not a big deal. Sometimes we'll make an incision and actually just excise that as well and do a combo approach.
Right. And I almost always do a combo approach. I did a lot of this when I was with the military.
Mm-hmm.
I would try to do liposuction only, and occasionally, if you don't address that little bit of breast tissue behind the nipple areolar complex, and they come back, it looks good, but they feel like
They
their
can feel
nipples
it.
are puffy, or it gives
Yeah.
their nipples a puffy look. And
Yeah.
so there are a few instances where I did one recently in a teenager who was a little heavier, and we did liposuction only, actually, and added Renuvion for skin tightening to avoid
Mm-hmm.
doing a skin excision. And he absolutely didn't want any like visible
Incision.
scars on his chest, right? And I get that. We have these little holes where we put the cannulas in. No one can tell that you had surgery.
Yeah. I mean, it could have been a mole. It could have been a cut. I mean, a lot of times you
Right.
can't even see it.
Right. So it's like every procedure we do, it's patient selection and then making sure we tailor it to the patient. And then there are a few patients, active duty military sometimes, who are like extremely fit, have no body fat, and really just have that little retro areolar breast tissue that needs to be
Mm-hmm.
excised, and that can be done without doing the liposuction.
Yeah.
I usually directly excise it. I know sometimes surgeons will use weird tools to shave it down or whatever, but I really
I do
found...
the same. Like you just pull it out a little and excise it.
Right.
Although I have to say, so often it's done through an incision right around the areola.
Mm-hmm.
And there was actually a discussion the other day among some of our colleagues about doing the incision right across the areola because you can get this weird puffiness at the edge. And
Mm-hmm.
I see the advantage there. I think I am probably going to switch to that and try it because you don't want that areolar definition, especially in a guy. It's okay in a woman after a lift, but for a guy, there's a good argument for going right across the areola and then it blends in a little bit better. I don't know. Have you tried that at all?
I've never done it. I've seen it in patients a couple of times. Sometimes it's more, if it heals. If it heals perfectly when you do the areola incision, the border, it's really
invisible.
hard to see.
Yeah.
I could see the advantage, and I really do try to evert and like kind of make sure that there's tissue underneath so that there's less opportunity for things to dip down.
Right.
I did work with a surgeon at it wasn't a cosmetic setting, who would make the incision like straight up on their chest because the argument was that then it doesn't look like a gynecomastia incision. I'm like, yeah.
Probably doesn't really look like a cosmetic surgery incision.
It looks like they got stabbed, but okay.
But
in
on both
different
sides.
Locations. Like it was really insane. And I was like, okay, you do you. I don't know that I would want that. Like you're worried about people looking at your chest, and now we're going to put these 2 like 3-centimeter incisions in random places. I don't know. And then
that's interesting.
Yeah, I've never seen anybody else do that. And then in San Diego, I mean, I don't know. I'm sure Ohio's the same way, but everyone's tattooed. Have you ever?
Oh, yeah,
Yeah.
full sleeves. I mean, the anterior neck tattoo even is
Yeah.
becoming more popular these days. Yeah.
So it always used to, the whole thing about trying to make the incisions as small and inconspicuous as possible, because, right, we're talking about your chest. And the last thing we want to do is fix the contour, you know, make the contour better. But then, like how I'm talking with a hair tie, fix the contour, but then draw attention to your chest with these weird incisions.
Right.
But it was always super interesting to me that some of the guys who were very fit and their concern was gynecomastia would have like their tattoos centered on the center of their chest. Like basically
like in between.
Look here. And you're like, why? I don't know. It's subconsciously. Anyway, it's an easy, it's a very gratifying surgery. And
It is.
I think it's a common problem, right? I mean, 2/3 of adolescent males will have gynecomastia, but overwhelmingly it will resolve. So
right. But in a lot of people, you know, there's that little bit left, and it's fine.
Right.
If you don't like it, we get rid of it.
right.
Yeah, and it's not a terrible recovery. I mean, the chest is really sore. I imagine as if you did a bunch of push-ups. I know that's how my abs felt after lipo. Was like I'd done 1,000 crunches. And we do put you in compression for a little bit because we don't want hematomas and swelling. So they make these very masculine compression vests.
Yep. And then, I tell them to lay low for a couple weeks, like not to do anything too strenuous for 2 weeks. And then you sort of build back into it.
Yeah.
And with liposuction, I tend to tell people that it's like a sprained ankle. So it has that ability to swell for a while. So the compression's great for helping with that. And if you increase your activity, you know, you're at 4 weeks out or 6 weeks out, you're not wearing compression, you're mostly gonna swell and then put that compression back on to help your body.
Right, exactly. And that's true after a tummy tuck too. You'll see that puffiness pop up. And we have a question. Do you think there's a stigma around gynecomastia or a lack of awareness that it's treatable? You know, that's a really good question, Alicia. And I don't have my pulse on the male community. I suspect a lot of guys, A, probably don't realize how common it is, and B, that it's very correctable in a simple surgery that you don't even have to be under general anesthesia for. I've done these cases on awake patients, and they're very comfortable. So it's probably a combination of the two factors.
Yeah, I think men are shy to come in with a problem or present it. And then I think most people don't go straight to a plastic surgeon, so you raise that issue with your primary care doctor.
And they tell you it's normal.
They're like, oh, it's normal. So many people have that. And so that's the other problem, is that maybe whoever you reached out to with that problem says, you know, don't worry about it if there's nothing to do, and don't appreciate that there's some options.
Right. I mean, because most docs are worried about pathology and things that are harmful, and this is normal, it's not a problem, is very different than, hey, there is a pretty easy solution for this. And you're welcome. We love answering questions, by the way.
Thanks, Alicia. That's a good question.
Yeah.
So let's see, what else about male plastic surgery? I mean,
I do skin removal. I do a moderate amount of skin removal, like tummy tucks, and especially chest skin excisions after weight loss. That's a pretty common one. And even the occasional facelift. Guys like to have a sharply defined jawline as well.
Yes, I did one of those recently as well. And he was down for a facelift and CO2 laser at the same time, and some lids done and fat transfer. And he did great. Yeah. So,
chin implants and rhinoplasty. I actually do neither of those procedures. When it comes to face, I pretty much do eyes, face, and neck lift. But I have a good facial plastic surgery colleague in Cleveland that I refer to, Dr. Ponsky. She pops on sometimes, but she did a facial plastics fellowship. So I send that kind of stuff her way.
Yeah, and I have somebody I send noses to as well. I don't often do. I haven't done rhinoplasty in a while, so I think that's such an important area, and it also needs to be tailored for the patient and complex. And
there are a lot of like ethnicity subtleties too, especially with the nose, where it's really easy I hear and have seen, like, you don't want to give everyone the same exact nose because it's not going to fit their face. Yeah, that's a pretty complex procedure that I just didn't get a lot of training in, so never did. For
men, I think especially, like, I remember maybe 10 or 15 years ago being out in Miami and
thanks, Alicia.
Thanks, Alicia. Yeah, to try to, like, can't do it all, but we try.
Yeah.
But yeah, and going out and realizing that there were a huge proportion of men in this particular area, restaurant, bar scene in Miami, that all had the same nose, and it's a very feminine nose, and it was like popular at that, you know, at that time to do. Mm-hmm.
Yeah, so, and that's the interesting thing that people may not realize. There are like trends in plastic surgery, and you can look back at the textbooks for, sorry if you guys can hear my dog barking, I hope not. Lincoln! If you look back at the rhinoplasty textbooks from like the 70s and 80s, it was like this very narrow ski slope nose. Like you can tell what decade. And if there's a surgeon who does the same kind of nose, you can tell who went to him or her.
Mm-hmm. Yeah, it was uncanny. And that's another issue with male facial plastic surgery is really being careful that you don't feminize their features, because, you know, 80% of what we do is on women when we're talking facelift, and when people give huge presentations and show all their before and afters at our conferences, it's, you know, woman after woman after woman, but then you don't want to embrace that same technique on a man and end up, you know, you're not trying to create the graceful S curve and, you know, the tiny, you know, the eyes. And
well, with eyes, if you do a brow lift on a guy, you do not want to give him arch. No. You know, women, we fill the cheeks so they're nice and full. Guys have flat cheeks. And then the sideburn is a whole other issue with facelift, because we're pulling the skin back, and then you can end up pulling some hair-bearing skin back onto the front of the ear and needing to do laser hair removal or electrolysis there.
Right. Yeah. It gets tricky with the beard, you know, where you can grow a beard. I have seen, I had a patient who came to me, and we're just letting things settle, who had a direct brow lift done somewhere else, and they just did laterally, and you know, it's exaggerated at the beginning anyway, so we look kind of insane. And I was like,
just very perplexed.
Yeah. And I was like, that's not, you know, they want a straight brow. That is the look. And you can think of examples, Kenny Rogers, or trying to think of who else. There's some good examples of people, male actors, who've just gone off the deep end with their plastic surgery. And you're like, people might not know, but they just can't figure out why it just doesn't look quite right, you know?
Right. Well, and facelifts too. So with facelift and neck lift, the direction of pull is all back here. And if you're ever wondering, I shouldn't really tell our secrets, but if you're ever wondering if somebody's had a facelift, you look to see if there's a little tension here. And in guys especially, it's tough because they wear their hair short and the incision hugs along the hairline. And in women, you know, even with our hair down, there's like little wispies, it hides pretty well. But with guys, if they've got a close cut, sometimes you can see that scar. So it's a little more demanding almost sometimes.
Yeah, absolutely. But that they definitely tend to be more realistic about the approach, and don't want to look overdone. And I think that's
right.
That can be refreshing too. So yeah, I think it's just a slightly different patient population with needs, but they want to look refreshed and not overdone, just like most of us do. And
exactly.
Yeah.
And I do have a fair number of guy patients who come in for toxins like Botox, because, you know, they don't want their crow's feet and they don't want the deep frown lines. And with that, it's, you know, you freeze everything and it looks good. It's not, you can't really feminize people with toxin like you can with filler, thankfully.
Yeah, definitely. Do you find that you need more toxin than average?
So much. Well, you know, so the little vertical muscles here are your glabellar muscles, and they're called the corrugator supercilii. And women it tends to be a thinner muscle and a weaker muscle. Although I've got some women too, where there's just these really strong muscles, but men tend to have just thicker, stronger facial muscles. So my toxin doses are generally much higher on men. Do you find the same thing?
Yeah, I still remember in training, we had an anesthesiologist that was going to get his Botox done, and they put something like 75 units just in his forehead.
Okay,
But I
that's
was
a
like,
lot.
that's a lot.
That is a whole
You
lot.
can usually do my whole face with 50-ish.
Yeah.
So
Yeah. I mean, like if I use 20 on a forehead, it's a lot. Ooh, your husband's resistant to toxin, Alicia? Interesting. I wonder if
yeah,
he never
just
got
got enough.
enough. Yeah.
Hmm.
Or if he works out a lot. Some people who are really physically active have zinc deficiencies, and zinc is a cofactor for, I forget which part of the pathway where the toxin's taken up. But if you're zinc deficient, then the toxin doesn't always kick in. So who
No,
knows?
that discussion came up randomly and I looked up the paper for it, which there's like one paper to support
Yeah.
getting zinc.
By people
But
who sell like that supplement brand.
yes, right, right. But I tried to remember to take my zinc on it, to try and see if I could prolong my Botox effects. But I just can't remember to take vitamins. It's not, there's only, sunscreen I can do every day. The rest of it is,
Yeah, hit or miss.
I have to start triaging my capabilities. Same thing with the supplements for hair,
Oh, yeah.
yeah, he might have a vitamin deficiency. People who consume a lot of protein and work out a lot sometimes metabolize it faster. So Botox is funny because it's dose dependent, meaning the more you put in, the longer it'll last up to a point. So
Right.
you have to find that sweet spot, and it's different for everybody. So, but guys tend to like
Lots of high doses. But yeah, guys do burn through stuff a little bit faster sometimes.
yeah. They also tend to run higher blood pressure. So in terms of, surgery, I am a little more cautious with them because we don't want their blood pressure to elevate, don't want to have any bleeding complications afterwards. So
Right.
I remember it became, and that's because they have more testosterone than we do. And I remember I don't do much of it now, but I did a fair amount before of top surgery. So that it's sort of male plastic surgery to go from female to male, to take off the breasts and reshape the chest to look like a male. Those patients are often on testosterone supplementation, and it says they're transitioning. And there was initially controversy about taking them off the testosterone for the surgery to reduce the risk of having bleeding during top surgery. Yeah.
That seems like that would be a pretty big deal, though.
Yes.
To stop hormones.
Yes. So they're just like other things. There's people who will do it, just like the random incision on the chest. And yeah, and I thought, no, that seems like a big deal to take. And I think probably now most people do not take female to male. People who are transitioning don't say, hey, we're going to stop this transition hormonally just so we can do this surgery. Because they feel crappy. So it's not fun. But it's interesting. It proves the link between testosterone and kind of high and blood pressure issues and more propensity for bleeding. So you just have to be careful. Yeah, I like to say it's just because they don't listen, but it's not true.
I've had female patients do the same thing. Though.
I know. I just have been married too long.
10-mile hike, you're 3 days out from surgery.
Right. Did you need that 10-mile hike?
Yeah. Although I have seen guy patients get a little more active, go for long hikes, play around at golf. They're like, it's nice out. Yeah. So that's the important thing. You should always be really cognizant of your instructions and following them, because it's really so you can heal quickly and get a good outcome.
I know. It's hard to grasp the long run, short slide, but you really have to. I try to talk a lot when I'm talking to patients about surgery to spend a significant amount of time on recovery, because you have to give yourself enough time to recover. Otherwise the recovery just lasts longer if you're not careful. Yeah. So, yeah.
Let's see. Do we have any other little interesting tidbits to share?
Penis enlargement?
No, I don't do it. Yeah. No, I know nothing about it. So I'm happy to talk about it.
I feel like we've had a couple inquiries and we're like, delete.
We've gotten inquiries for scrotopexy, like if it hangs too low to pexy. And that just brings up scrotox, which is I've never done, but there's the occasional request for Botox to the scrotum to smooth the wrinkles. Yeah.
Not offering that currently either.
Not something we offer at our practice.
I do know that there are people who provide fat injections to the shaft of the penis as an enlargement procedure.
I've had people call, that just seems like a really dangerous idea to me unless you're a urologist.
Mm-hmm.
I mean, there's important vasculature and nerves and yeah.
So yes, just to be clear, we do not offer those procedures.
I'm glad my nanny just popped on too. So Bridget, if you were wondering, we're talking about penis enlargement. You hopped on at the right time, and that we don't do it.
Yeah. And then when I was in the Navy in the hospital setting, I did work with the urologist a couple of times on people who had gone out into town and had some surgeries that were not, that didn't work out well. So I was like, there are 4 plastic surgeons, 3 of them are guys, and you presented this problem and you guys called me, like, give me a break. But there was somebody in Beverly Hills placing a silicone wrap around the shaft, and then, you know, that's eventually has a potential to erode, and then it's a problem. So
that sounds like a terrible idea.
It is a terrible idea. So not a long-standing solution. So anyway.
I think I'm going to stick with the liposuction and the facelifts and the occasional
upper eyelid lift.
Yeah. I'll leave the nether regions to the people that do
who
that.
Are interested in doing that. Yes.
We don't need that here, but I'm all for it. Bridget, you're hilarious.
Yes, if it makes you feel better about yourself, sure. I don't feel comfortable doing those procedures.
No.
Happy to refer out.
Yep.
I know Erin, who was on this probably a little bit ago, always has to ask me, who is it that does butt implants in San Diego? And I only know one guy. I think it's a terrible operation. So we've talked about BBL before, but I don't do actual butt implants, which are actually silicone breast implants placed in the butt.
And they can rotate. And they're not made for sitting on.
No.
Yeah, that's not one I've ever wanted to do. I have a friend.
Taken them out.
Yep. I have a friend in Austin who does them occasionally. I see him on his Instagram. Really? Yep. He does a ton of BBL and then occasionally some implants. So I don't know. Some people do them. Not one.
And calf implants is the other one that I think is just a fraught with problems.
Yeah. The only thing I know about it is the Discovery Channel show I saw where somebody got necrotizing fasciitis and like lost half their calf.
Yeah.
So, I don't know.
Yeah. So the other male plastic surgery procedure that's sometimes done that is also touted at conferences is high def liposuction, which I don't do.
Ooh, liposculpting. Yeah. So that's for you guys, by the way. That's where you're like trying to etch in the muscle pattern by selectively removing fat. And I don't do it either. And the reason is, I mean, I will do a little more in the midline sometimes just to get a little definition, but trying to etch in those 6-pack muscles, imagine what happens when you gain weight down the road. It's going to be like you have a little 6-pack of like rolls on your tummy. Yeah. And it's not necessarily going to line up with where your actual muscles are. So
I feel like it's cheating, but I mean,
I would,
good. Yeah. I feel like that question always gets asked when someone presents these crazy results where someone is obese and looks like they've never seen a gym, and then they have this high def lipo result that makes them look ripped. And the answer is always that now these people are so motivated that they go to the gym and they stick with their routine. But I would say based on human nature,
unlikely. I can tell you, I did not have a 6-pack after my lipo, and there was not much fat left. It's just like, you got to get the muscles. Yeah, I would love to see those high def lipo pictures like 20 years down the road, just like the BBL picture. I want to see what that looks like 20 years down the road.
Yeah, the 1 or 2 liters per side. See what happens there.
Yeah. There was another video I was watching where they were doing fat grafting to the pec after liposuction gynecomastia, just to build up that pec definition.
I saw that too. I think I saw that because they really do etch out the pec muscle. But it's like you can't just do one body part if you're going to do that. So you do all that to the pec, but then the deltoids look a little, less,
or the less
cut. So then you go and define that, and then you just keep following along. And then 20 hours later, you're done liposuctioning. So kind of cheating with the adding the fat where muscle should be. But
a little bit.
it's okay. It works for some people, and there's patients who are good candidates for it as well, and surgeons who offer that. So
yeah. Cool. Well, what should we talk about in a couple weeks?
Oh, that's a good question. I think I don't know that we've done the breakdown on tummy tucks yet.
Yeah, I don't remember. We also haven't talked a lot of face stuff either.
No, that's true. We could talk
like
about
facelift or eyes. Yeah, I love both.
Or the neck. Everybody wants to know what you can do for your neck.
Yes. Yeah, we can definitely talk about that. And definitely like non-surgical stuff too, because I get a ton of questions about that. And I'll be honest, I don't love the non-surgical options. So
but
let's talk about
there
the
are
neck.
tons of options. Let's go for the neck. What can we do about the neck? All right. Have a great couple weeks. And thanks for agreeing to talk at WPS.
Oh my gosh, I'm so excited. I have total imposter syndrome. It'll be awesome.
Oh no, it'll be fantastic. Yeah.
But if there's one thing I know how to do, it's talk. So I am excited to be
That's awesome.
I'm really good at talking. I'll bring some pictures too. All right. We'll see you guys in 2 weeks.
Bye. Have a good night, everybody.
Bye.